The prostate is a gland of the male genital system formed by fibrous and muscular tissue, located below the bladder and in front of the rectum. With advancing age, especially after the age of 50, and the hormonal changes that follow, the prostate gland tends to increase in volume. This is because the epithelial and stromal cells that line the prostate begin to proliferate excessively, causing the prostate to enlarge. This medical condition is known as benign prostatic hyperplasia, or hypertrophy, and as the name suggests, it is a non-cancerous growth of prostate tissue. However, if left untreated, it can cause a series of urinary tract problems and kidney complications, up to completely blocking the emission of urine. In the last video, which you can find by clicking here above, we saw what are some foods to limit in case of benign prostatic hyperplasia. In this one instead, we will see which foods can help to combat prostate enlargement. Garlic. Originally from Central Asia, garlic is a bulbous plant, characterized by particular fibrous roots and a smooth and rigid stem that can reach up to 1 meter in height. Garlic has been used for thousands of years in cooking as a condiment for its intense smell and pungent flavor due to the release of some sulfur compounds present inside it as soon as it is crushed or cut. Among the many beneficial properties of garlic, we also find those related to prostate health. A study conducted by some Chinese researchers has highlighted the anti-proliferative effects of garlic on the progression of benign prostatic hyperplasia, as some compounds have been shown to inhibit or slow down cell proliferation, that is, the growth and division of cells. Garlic administration to mice with induced benign prostatic hyperplasia has been shown to reduce prostate weight, lower levels of some inflammatory proteins in prostate tissue, and lower serum levels of DHT, also known as dihydrotestosterone. This is an androgen hormone, which if present in the body in excessive amounts, can promote prostate enlargement. According to a study conducted at the Faculty of Medicine of Ankara University, Turkey, supplementation with aqueous garlic extract for 1 month significantly reduced prostate mass as well as decreased urinary frequency. Garlic has thus shown promising anti-inflammatory and anti-tumor effects, so much so that it is also used for the treatment of prostate cancer and to relieve the symptoms of benign prostatic hyperplasia. Onion. The onion is a bulbous herbaceous plant belonging to the same family as garlic, shallots, chives, and leeks. White, golden, and red are the main varieties of onions, each with unique characteristics. Rich in beneficial properties for health, onions contain vitamins, minerals, and antioxidants that help strengthen the immune system, protect the heart and blood vessels, as well as promote intestinal transit and improve bone mineral density. A study published in Nature in 2008 highlighted that a higher consumption of vegetables of the Allium genus has shown beneficial effects in various disorders affecting the prostate, and in particular, they seem to be associated with a reduced risk of developing benign prostatic hyperplasia. The exact mechanism is not fully understood, but bioactive compounds, such as flavonoids and sulfides, are thought to have anti-inflammatory effects, reducing inflammation of the prostate gland and abnormal cell proliferation. Tomato. Originally from South America, the tomato is a herbaceous plant that produces characteristic red berries and is the basis of many Mediterranean dishes. From the preparation of sauces, bruschetta, fresh salads, to the much-loved pizza, the tomato is one of the most appreciated and consumed fruit vegetables in the world. In addition to containing numerous vitamins and minerals, such as phosphorus, zinc, iron, and potassium, tomatoes are an excellent source of lycopene, a carotenoid that gives them their characteristic deep red color. Not only does it play an important role in preventing cardiovascular disease and some forms of cancer, but it has also been shown to protect prostate health and reduce the risk of prostate disorders. According to a study conducted by Australian researchers, lycopene supplementation may lead to a decrease in the incidence of benign prostatic hyperplasia and prostate cancer diagnoses. Although not a statistically significant trend, this systematic review also showed an inverse relationship between lycopene levels and PSA. Also known as prostate-specific antigen, it is a glycoprotein produced by cells of the prostate gland, with the aim of maintaining the seminal fluid in its proper consistency. It is a very important marker, as it is used as an indicator of potential prostate disorders. It is important to remember, however, that cooking and preservation methods can affect the content and bioavailability of the substances present in tomatoes. When cooked, for example when used as a sauce for pasta, the heat releases the lycopene present in tomatoes, making it much more absorbable by the digestive system. On the contrary, when they are processed raw for too long, and with metal tools, lycopene can oxidize and lose some of their properties. Citrus fruits, mandarins, oranges, and grapefruits, lemons, pomelos, and cedars are just some of the fruits belonging to the citrus family. These are evergreen trees or shrubs, often with scented flowers and fruits, rich in vitamins and mineral salts, especially vitamin C. A study conducted at the Department of Oriental Pharmaceutical Sciences in Korea examined the therapeutic effect of Hesperidin on benign prostatic hyperplasia. It is a flavonoid present in particular in citrus peels, and in the albedo, the whitish inner part of the peel. In studies on animal models and in vitro, Hesperidin has been shown to improve the symptoms of benign prostatic hyperplasia, attenuating cell proliferation and the inflammatory response, intervening on a particular cell signaling pathway. Hesperidin has also been shown to selectively inhibit the growth of prostate cancer cells by triggering apoptosis, opening the door to the possibility of using them as a lead molecule for the design of anti-cancer drugs. In conclusion, we have seen how nutrition plays an important role in maintaining prostate health and reducing the risk of developing benign prostatic hyperplasia and prostate cancer. It is important to remember, however, that the foods mentioned in the video cannot and should not be considered as a substitute for existing therapies in the management of enlarged prostate gland or other related pathologies.